48-year-old female presents to the office with complaints of myalgia, weakness that she's been having for the past 8 months in her hips, chest, and generalized all over her body. She's been having bilateral upper extremity and lower extremity pain with trouble holding objects for the past several months. She claims that it is more severe when she's using her extremities, especially her wrists, and moving along with her hips as well, and is relieved by rest. It can get to as high as a pain of 7 for her pain, and she's been just taking Tylenol and ibuprofen for her pain. She also has a history of osteoarthritis and a bulging lumbar disc. And she also has a history of type 2 diabetes, high blood pressure, and she also has a lumbar disc hernia. So for this patient, she has also been having bilateral wrist pain, and she is a worker at a grocery store in which she stocks shelves and is constantly using her arms to move things. And she at home knits as well and uses her arms a lot. So she had previously seen a doctor and did a autoimmune workup, which was negative for her. She had an ANA done, which came back negative, but we are suspicious. Vital signs include 128/82 blood pressure, pulse 72, temp 97.9, respiration 16, oxygen saturation at 97%. The patient denies any current dizziness, fever, shortness of breath, chest pain, palpitations, chills, and diarrhea. Patient is alert and oriented ×4, head is normal cephalic, sclera is white, conjunctiva is pink. Eyes are perla with intact extraocular movements. Mucous membranes are pink, moist. Nasal passageway is pink. Throat is pink with no exudate. Airs are non-erythematous. Her lymph nodes are non-palpable and not inflamed. Lung sounds are clear with non-labored breathing. Heart has regular rate and rhythm without any murmurs present. No lumps or bumps or nodules on the breast. Abdomen is non-tender and non-distended. Bowel sounds are present in all 4 quadrants. No rebound tenderness. And she has no skin lesions. And her gait is steady, even though with this weakness that she's been having generalized. For the past 8 months, she's been having this weakness, which is gradually became a little weaker and weaker. And this pain she's also been having in her lower extremities is more pertained to her hips. She had MRIs done of both of her hips, which came back for muscle strains in both hips. For this patient, we're going to send a referral to orthopedics because of the MRIs of the hips and her back as well, and also for possibly pain management for her as well. On the safe side, we're going to send a referral to rheumatology for suspicion of an autoimmune condition. Even though her last autoimmune workup was negative, it lines up with differential diagnoses of either multiple sclerosis and other autoimmune conditions as well, possibly lupus. For her as well, we will order an EMG for the patient since she is using her arms, and her pain in her wrists and her arms is more tender and more painful after using her arms or using her phone or even at work, and is relieved by rest. But we're going to order that because of the weakness and the wrist pain. We're going to order generalized labs, including CBC, CMP, folate, hemoglobin A1C, lipid panel, microalbumin to creatinine urine ratio, TSH, vitamin D, and we're going to have the patient follow up in 6 months and make sure to keep in communication with us even after the referrals, and we're going to make sure we keep in contact with her.